A warm welcome to all our viewers to our series Natural Medicine. Today, my guest is a very impressive lady from Austria. She's connected from Vienna. She's a lady who has dealt with the subject of cold red light, has developed a technology that has just won an incredible award. Again, a prize where the effectiveness has been proven, which shows what this technology is capable of. And of course, I'd like to learn a little more from her today. Stay tuned, we'll get started right away. Now, let me introduce the lady to you. It's Miss Brigitte Rumpold. A warm welcome, dear Brigitte.
Hello, Alexander.
And of course, congratulations on this award.
I have to say that, of course, it was the doctors who did the study that received it and not us. But it was with our therapy.
Yeah. Now, tell me, what kind of award was that?
It was about being able to measure pain objectively. That is pretty difficult, doing studies with pain, comparative studies at all. It's very, very difficult, and they found a way to objectify pain. And they can really show significantly how the improvement then occurred. And for this method, they invented, and of course for what came of it, namely that you clearly saw how much the pain has improved. The Austrian Pain Society gave the award to these doctors, and let me say a little bit also to REPULS. We were, of course, incredibly happy about it.
Because this way of treating pain from one group to the other group has always taken place with this cold light therapy.
Exactly.
And here you could clearly and significantly demonstrate how that works.
Both arms were, so to speak, put into a box that was covered, so neither the doctor nor the patient nor the observing doctor knew which arm is the one that is now under treatment and which has a placebo, because you don't feel cold red light. And then, with the help of thermometers and all kinds of methods, it was really measured how this pain subsides. So not just the patient's statement, but really measurable.
I just find it so regrettable. Now we know that there are such proofs of effectiveness. We know there are technologies that immediately and noticeably reduce pain without having to use chemicals here. And yet, almost nobody knows. Here it seems to me that the Austrians are just a bit ahead, but I believe your health insurance in Austria is also ready today.
No, not at all, but partly. We are currently fighting to ensure that it will generally be the case. They have merged in Austria, and actually, according to the law, they all have to act in the same way. But it's just not like that. And 3 insurances pay for it, the others play a bit hard to get, so it's still a bit of a mess, but we will manage.
So that means buying such a device, or the rental of a device, is also paid for by the health insurance.
Exactly. So for renting, that happens relatively often. It gets more difficult when buying. It's usually half of the price. There have been cases where the whole thing has been paid for.
It's unbelievable. And what about in Germany and Switzerland?
Well, in Germany, we just got in touch with someone. You just really need someone who leads you to the right people, because otherwise you are constantly in the queue. And that's what we've done now. And I hope that we will get at least 1 or 2 insurances next year as well. However, it will not be for the pain, but for wound healing in diabetic wounds, diabetic ulcers, these issues. It will go in that direction. But that will be a start.
A start. Because you have done an academic medical study, which is recognised by conventional medicine, on the one hand in the area of pain therapies, and on the other hand in the area of wound regeneration, wound healing.
Exactly. It actually goes in 2 directions, what we've done. We started with cell studies. Then Dr. Dungle who is one of the leaders at the Boltzmann Institute, did this for us, where we first demonstrated what regeneration takes place in the cell. Increase in ATP, cell respiration, oxygen enrichment, nitric oxide improvement. So all of these things that help the cell regenerate faster. And when you say if the cell is healthy, the person is healthy, then there is, of course, already a great part done. And then when we saw that a lot really happened via cell regeneration, then we moved on to the clinical areas. That is the more difficult part, because then, of course, you have to deal with the ethics committee and with all these issues. And we've already achieved quite a bit there. We're now running 2 more studies at the Medical University of Vienna. And so these are also about, for example, how to treat breast reduction, because that is often a very painful subject, and especially the germ load is a big issue. And we have developed a lot for that. Well, we're pretty much on the advance in a direction where one can say that academic medicine can no longer deny us.
So that means that today we know that cold red light has a special frequency, I'll come back to that, is able to stimulate the mitochondria inside the cell to produce more ATP and consequently to accelerate the self-healing process from the inside out.
As I said, we are now in 2, almost 3, and maybe I'll explain the 4th pillar separately. There are 2 great pillars. One is cell regeneration. We always say we go from healthy tissue to diseased tissue. So the irradiation method does not go primarily on the focus, but we make sure that we get from healthy tissue into diseased tissue. And the second, and that is actually the very important thing, is the anti-inflammatory effects. There are really big, also published big studies on this that have also been published, and you could see very well that this, how should I say that, you can just stop the inflammation. Even if you just take tumours now. They are mostly located in inflammatory tissues. I'm actually not allowed to say it out loud because these are topics that you shouldn't actually mention, but I'll do it anyway. We have heard very, very often that tumours were also easier to treat then because the inflammation around it is improved. And then the tumour was easier to attack. So these chronic inflammatory diseases, which causes long-term problems in many areas, I also want to mention now, for example, what kind of problem is in the mouth. These chronic periodontitis stories, they absolutely contribute to aging if you don't treat them. And with a lot of people, this is simply a chronic fact that hardly anyone cares about. You can treat that wonderfully with the light because it goes completely through the jaw. It goes through the tongue. So we measured that. There are also studies in which you can see how deep the light penetrates and, of course, treats the inflammation, which is very important, the foci of inflammation in the mouth very well.
That would be a good idea right now. You must have a device lying around. Maybe you could show that.
Of course, always a device.
Can you let that shine through the cheek so that we can see how strong it is?
I hope you can see it from here now.
Now, yes, exactly. Okay.
Can you see it?
Yeah, it goes in one place and out the other cheek again. You can almost see it.
We did an examination where an employee swallowed a camera. It was about inflammation in singers for vocal fold inflammation.
Miss Gertrude Berker-Schmidt, the professor, was surely involved.
Exactly, and you saw exactly when the camera was inside and we irradiated from outside, you really saw the light from outside. So in here, out there. And of course for singers and for all the people who have to talk a lot, it's a fantastic story. So the effects are pretty quick. Would be so happy if I could get hold of Jonas Kaufmann. He's got this problem again. But it's really pretty difficult to get hold of him. So that's the kind of inflammation that builds up everywhere.
But with cold red light, you always work using the milieu from the outside and then always go inside. And then after a while, for the milieu itself, the energy transfer is conducted into the core.
Exactly.
A gentle method. Now, tell me again quickly so that we're not confused. Cold red light is not an infrared lamp somehow, nor a light bulb with a red light.
Cold red light is the range between UV and infrared. This is just a very narrow range that we perceive as colour. This is visible light. Some know it when the sun shines, for example, into a puddle of gasoline. All the colours are reflected there. And these visible colours or frequencies of light have no temperature. And the red light range is still very narrow. In our case, that is 632 nanometers, which sets repair mechanisms in motion and is absolutely non-toxic. And that is actually the important thing. As soon as I go to the UV range, I always have side effects. And that's why it's a therapy that is completely free of side effects. And if you take it seriously, if I wouldn't look at all the approvals, can really represent a medicine cabinet for babies and up to a 100-year-old.
But it's not a laser either, so it's not a coherent beam.
These are, I don't know if you can see this, these are LEDs, high-performance LEDs, with 175 milliwatts, and that's a really powerful laser, you could say, which does not go into the tissue in such a fine way, but very broadly. So on this surface, we get about 175 multiplied by 7. So around 1200 milliwatts of power. That's really something, and that goes very deep, and it goes into the tissue in a cone shape. You could also really see that and reach low-lying structures. So really, where inflammations are also low-lying, we can reach them here. You have already seen that with bone marrow edema, for example, where it's usually very difficult to get to. And the advantage is that that is approved for private individuals because it has no side effects. And because of that, it's really easy to use it at home after an introduction.
I've already seen it in a few hospitals in Switzerland, and I think it's in St. Gallen too. This is a technology that doctors are already working with, but it's also approved for private individuals.
Exactly.
Well, that's actually a great idea as a preventative measure, isn't it? So what if, for example, at some point you would have a red light shower, where you stand for half an hour below it every day and actually strengthen the whole organism through that? Is that a wrong idea? Or is it a possible future option?
Something like this exists already. In the US, there's a company that already does that, but not with these intensities, because that is really intended to really go deep into certain areas. If you use it on the whole body, then I think you'd overwhelm the organism a bit.
Okay, good.
Maybe there I can add something that's actually always important to me. Hormesis is becoming more and more a term in medicine. This is the possibility. I think it's pretty exciting that you activate the cellular defense system with a low dose of stress. You do that with moderate exercise, for example. You do that with nutrition, for example. When someone does intermittent fasting, then they get a low threshold stimulus, which then improves the immune system. And you know, when you fast, you can very well compensate for certain deficiencies. And we have that here too. And the point is, we even measured that at the Boltzmann Institute. If the stimulus is too big, then it's not good either. And to treat the whole body, this has to be worked out very carefully, so I don't really want to say anything about the way they do it in America. I can only say how it looks for us. We have the high intensity for a smaller area, and for the large area you'd have to reduce the intensity.
Good, and now the accolade is coming. You also managed to get medical approval for this product.
Yes.
I don't want to know how much money went into that until you got this approval. That's a never-ending story, isn't it?
It's just starting again. It's just starting again because we're developing a new device that is almost a mission impossible, and our advisors tell us we can't do it alone, so you need advisors accordingly. And they say that many companies have unfortunately have to give up because these costs for these clinical studies for consulting, for the approval itself. So if we hadn't started this early, we couldn't do it now either. Which of course is madness because there are great devices which would deserve to be approved in the market. We know what we're talking about.
Yeah. If we only mentioned the keyword Tesla.
Yes, I'm a big Tesla fan. I have 2 devices at home myself. I love the synergy, so I use both devices. But it's madness. So if you have to start over right now, for example, there was another incident. We're on a ventilator for asthmatics or for COPD people. The foam rubber has dissolved in the hose and got into the lungs. There were very serious incidents. A very, very, very well-known company that this happened to. And now it's getting stricter again. Every time something doesn't work somewhere, everyone notices it immediately.
Ultimately, it has its advantages somehow, namely being able to learn from damage, but that also means that only a few can still afford it.
That's a problem.
And a lot of good things are left behind or disappear in the drawer, right? And that's sad too, but you did it, at least. Congratulations. And I'm very happy about that too. But now, tell me again quickly, for what kind of integrations would this be possible? Also with rheumatism, for example, or...
Yes, rheumatism is something we treat very regularly. We're also in the Austrian Rheumatism League. We work with them. Rheumatism is an area that takes a little longer to treat, obviously because it starts out very painful. You have to start with very small doses. That's what our nurses do. They look after all rheumatism sufferers. There are quite a few of them and they take care of it very well. But you can expect that in about 3 months you can skip most of the medication.
Wow.
But then you have to be patient. You really have to do it every day. But most of the patients are that tired of the medication that they actually enjoy doing it.
Good. You said all forms of pain, from toothache, knee pain, rheumatic complaints, everything can be treated well. And wound regeneration. So wound healing processes can be accelerated.
Especially in the area of diabetes, it works so well. Anything at all that are open inflammatory areas. I would like to say one thing briefly about this because I know that many people are interested. I treated that very well on myself, namely the Cooperose. Many women suffer terribly from it. This is where you get those red cheeks and then it gets worse over time. I got rid of that really well with green tea, with aloe vera and radiation.
Wow, bravo.
So that's really, like I said, I love synergies. I get everything from wherever I think it would work well together. Among other things, of course, I'm a big fan of zeolite. Professor Hecht, an amazing guy.
Isn't he? He also hit like a bomb. What are you saying?
I'm sharing this endlessly.
Yeah, great.
But these are the things, they all belong together. It all belongs together. I don't like it when someone says, just my solution.
Now, I've already prepared 50 programs for 2022 with Professor Hecht on silicon to simply document the knowledge he has. And he's just brilliant. But let's go back again. You have a medically approved product, and now that comes to the private individuals. I only know that with medical devices through training, thorough training is mandatory. Can I simply buy a medical device without training? How does it work with you?
No, so we really have, especially when it comes to training, firstly, we have a free one. Online consultation with Dr. Schmid, you know her too. Every Wednesday you can call us free of charge if you have a problem.
Maybe very briefly, sorry dear viewers that you always hear a knocking here. Unfortunately that has just started. We have a construction site outside and this is a live broadcast. I can't change it, the craftsmen are there, so sorry, do stay tuned. Sorry Brigitte, just go on.
I was just about to say this online consultation with Dr. Schmid. Wherever I can inquire, is this for me? Would that help me? Then we have our nurses who consistently look after someone who buys or rents a device until really has its effect. And most of the time someone buys or rents a device, then grandma, grandpa, aunt and uncle come too, and then they all become taken care of too, until the family really says, well, we'll keep that now.
Great, wonderful. Now, you mentioned the word rent before. Is it also possible to rent a device, test it and see how my body reacts to it before buying a pig in a poke?
It is also the usual way. Most rent it first, and then they are looked after, and then you see what it does for you. Does it really help me? So nobody needs to buy the pig in a poke from us, no, because the device is not cheap either. You have to say that, but it's just that the rent is then taken into account and the care remains even after the rental. So it's not like that when it's over that we no longer take care of them. We did the math. I have to tell you now, we now have 5,000 treatments a day through the hospitals, rehabilitation centres and so on. This, of course, gives us a foundation of experience that is fantastic, and that's how we get so much feedback, how you can do something better, and so on. So I think that's good.
I'm really amazed what you've built up there. How many years did it take? How many years did you work to get this far?
I met Professor Torreser, who invented this 13 years ago. Immediately after he told me how the device works, I said immediately, I'll go with you. I have been working with light for a long time, so I knew exactly what its enormous healing properties are. And maybe, to quote Nikola Tesla, if you want to explore the secrets of the world, then one has to think in terms of frequencies, vibrations, and energy. That's exactly it. It's pure energy, it's frequency, it's healing vibration, and that is scientifically proven.
Now, the question, if I am now with a doctor, for example with a therapist, can I already assume that they know the technology and use it with me? Or do I have to address it explicitly? What do you think?
Well, a lot of people in Austria already know it because there are a few hundred doctors. It's much less in Germany, where we have 2 clinics. This is a Silk Children's Clinic, who uses it for the children, and a dermatology clinic. It is primarily private individuals in Germany who have heard this from someone from QS24 who have come to us. And we are now building a pharmacy network that the patient really receives optimal care from the pharmacy. There will always be a trained staff member in the pharmacy, and we will take over the assistance. Mrs. Selter was with you too. Now her name is Selter, then she was still called Mrs. Carmes. She has now married. She's in charge of the whole thing in Berlin. And now we want to expand through the pharmacies.
It's crazy. First the medical approval, making an excellent product, all the bureaucracy, and at the end you take care of sales. So this technology somehow gets to the clinics and doctors. That's a separate sales department again. Addressing private individuals is completely different again. But I think that you go through the clinics and doctors really speaks for you, not going the easy way, but taking the much more difficult difficult path, but there is also a completely different seriousness behind it.
But that was the only way to make this difficult path from the beginning, because I really wanted that this is recognised by the doctors. Light and frequencies, and you just have to say that. That's something recognised. This is not hocus pocus, it is not esoteric in that sense. And I see that as a bridge to academic medicine. And you just have to go this way, really seriously somehow, then you can also bring in the academically trained doctors.
Sure. So if the viewers would like more information now, just want to read everything comfortably from home, want to get information about the red light, about vibrations, frequencies, the energy in it and so on, is there a platform you could recommend where I can read about it?
This is our homepage, but we have an app that you can download for free, where there is a lot of information on it. So first, how to treat and what to treat. There are a lot of small videos on it. There is something from QS24 on it. And with this app, you can get a lot of information. Just search REPULS app in the Google Play Store. I think there is another one. You can get it for free, and then you can get the info or on our website.
But on your website, are there all the studies that are already finished and concluded?
Yeah, there's a separate section where the studies are included. There is a film project in there where a doctor explains exactly how to treat properly. There are references. I think there is a lot to get the relevant information here.
Now, QS24 is also a platform for a large number of doctors and therapists who also continue to get educated here. Also, these colleagues and these experts, these doctors who would be in good hands to consult with you if they just call.
Well, the way it works with the doctors and also with the hospitals, they get the device for 4 weeks free of charge for testing, are supervised and trained during this time. And then after 4 weeks, they can decide if they want to continue, lease it, whatever.
And if a patient is seeing a doctor for the first time, the doctor treats the patient once on the knee, seizes the opportunity because they can test the device for 4 weeks, and the patient is treated for 30 minutes every day, 7 times. Can the patient then already tell the doctor a result? And can the doctor recognise this?
After one time?
No, I would have said 7 times now, 7 treatments.
It depends on how acute it is. When something is acute, it happens very quickly. When I've just got hurt, things like that. Or what also works quickly, interestingly enough, are topics such as, I am in pain. I'm just saying this about myself now. I do regular liver treatments, and here and there it pinches me because I may have sinned again. The resveratrol in red wine, as usual. And if you irradiate, the feeling of well-being comes quickly.
Super.
So you just have to say that if something is chronically tedious, that it also takes a little longer. But I would really say that on average, after 3 or 4 weeks, after renting the device, someone knows what it can do for the patients, what it can do for me, and so on. That's actually always enough.
Great. And with acute pain, great pain, will the patient quickly notice that things are getting better?
Exactly.
Well, then it's really worth trying to say, I hope it is also useful for me, or in our case, and then you look further. Great. Dear Brigitte, so again, my respect for your success.
I have my nose up there.
Because of the red light. So only for the audience, the light is up, then I can see her better when she has her nose up. Stop that now, we're getting into the farewell. I thank you very much, and again, I am very proud of you, really, what you have achieved. And got going here is really high quality, and it has been a difficult path with a lot of success, so thank you very much.
Thank you very much, and thank you for your support.
With pleasure, and thank you, and you too, dear viewers. We heard it, cold red light has the potential to relieve pain very, very quickly, to increase and promote regeneration. And we've just heard about the offer for therapists and doctors. So I can only appeal to you, test Test it out, try it, see it, whether your patients at home also react as quickly to it, and you can get your own picture of what studies have impressively proven. If you're still critical, read the studies, look at the results, get an idea about it. That's it for today. Thanks for watching. See you next time.